Hi, everyone. I'm Dr. Natasha Iyer, and next to me is Dr. Goska Nowak.
Hello, everyone.
Welcome, and thank you for your time. I've heard that everyone is zoomed out and they're tired of being in front of a screen all day, and so evening time, they just want to do anything other than be on Zoom. So with that in mind, thank you all for making time to join us, and we sure hope that we will meet and exceed all your expectations for giving us your time this afternoon. So, the immune system is at the top of everyone's mind right now in the middle of a pandemic. And for some people, it's this vague thing. They're not even sure what their immune system is or where it is. And then there's people who think, oh, it's just my immune system, and they're not even sure the complexity of it. Mm-hmm. So what Dr. Nowak and I are going to do today is tie it all together for you. I specialize in functional and regenerative medicine. So I used to be in the business of sick care as a traditional medical doctor. When it's broken, we try to fix it. Mm-hmm. And I now dedicate my life to helping people live longer and healthier through functional medicine. Functional medicine looks at your body and every system in it and looks to restore it back to its optimal so that you live a younger, stronger, healthier life. With that being said, the immune system is so fundamental to healthy aging and to whether you get sick or not. And I mean, all the diseases that you don't want to get can be tracked back to immune system function, right? And so, when I talk to my patients about the immune system, one of the first things I say to them, because I do an introductory workshop.
Recording in progress.
I say, do you know where your immune system is? And people go, well, yeah, it's in your blood, or it's in your neck nodes, or in the lymph or something. And I go like, wow, that's pretty brilliant. But actually, almost all of your immune system is in your gut. And that's profound for most people. They're quite shocked. And when we talk about digestive health and we focus on things like leaky gut and symptoms of bloating and IBS and constipation and SIBO, one of the most important things is these are all things that are affecting your immune system, because more than 80% of your immune system is found around your intestines and your whole digestive system. So in saying that, I'm not sure if any of you have heard about the microbiome. Your microbiome are bacteria that live inside your gut. And interestingly enough, there are 100 times more bacteria in your gut than there are cells in your body. I'll say that again. There are 100 times more bacteria in your gut than there are cells in your body. So you have to ask yourself, why is it that way? What could the reason possibly be? And one of the things is this microbiome helps train and manage your immune system. And so how these bacteria are in balance or out of balance affect you. And in my workshop, I have patients spend a few minutes drawing for me or listing for me all of the components of the digestive system. And almost everyone remembers to start with the mouth. And this brings me to why I have a dentist sitting next to me. You might be thinking, what does a dentist have to do with my immune system? What does a dentist even know about my immune system, right? Because all of you have been going to the dentist. How many of them are talking to you about your immune system? And this is why Goska is here. So Dr. Nowak is not just, and I don't mean to be disrespectful to dentists. It would be the same thing as me being disrespectful to doctors, right? No, everyone's necessary. So you have general family doctors, and then you have specialists, and then you have family doctors with special interest in things. So my training is in traditional medicine. I do emergency room medicine, but then I specialize in longevity medicine, functional and regenerative medicine. And Dr. Nowak has been in the field of dentistry for over 24 years now. the last 10 of which she has dedicated herself to wellness dentistry and holistic principles, which to me is the most critical piece, in that when I refer patients to her, it's for that reason. When I'm working on a patient's microbiome and all of the things that affect their immune system and their inflammation, when I send them to her, she understands that. Because as I said, patients talk about the mouth as part of the digestive system, but then they don't know what else there is about the mouth that has anything to do with what they're seeing me for. When I make the referral, they look at me and go, why are you sending me to a dentist? I have my own dentist. And I say, but she's not your regular dentist, right? She knows all the things that I do from a functional medicine perspective about the microbiome and inflammation and all the high level testing and advanced testing that we do. So why don't we drag you in right away after I babble and tell us what wellness dentistry and holistic dentistry is, and what patients need to know when I refer them to you, or when your patients should know why you're so special, actually, because they probably have a good idea, but you know how it is.
Yes,
you don't know how good you have it until you know how good you have it.
Yes. Thank you, Natasha. I love to chat about wellness dentistry, and I'm practicing whole spectrum of dentistry, from general dentistry to cosmetic dentistry to more holistic approach, just like you. But I love wellness dentistry, and there's a reason for that. I think as a dentist, I have ability to help my patients achieve or improve their health by recognizing and managing their oral conditions. Because as we know, the mouth reflects what's going on in your body. It's a mirror of health disease, right? What happens in your body and your mouth it's interconnected, right? So mouth is a gateway to your body, and that's very important. So how is it different? How am I different when patients come to me? First of all, I don't really practice the common model of dentistry anymore in any aspects, because I kind of graduated to that wellness dentistry, and I know that my dental work is going to last longer if I start with the why, right? If I start with the root cause. Exactly, right?
Yeah.
And that's what is different. When a patient comes to me with a dental issue, I step back and I try to figure out what's causing this patient to develop the condition in the first place, right? What's the root cause? What are the risks that are particular for these patients, and how can I manage those risks? Because I know if I can manage those risks, then maybe I have a chance to prevent that disease from happening again, right? From occurring again. So again,
and
prevention.
When you say the disease, there are so many, and to use a big medical term, oral systemic health connection and all of that. But, something as basic as heart disease, most people have no idea that their mouth is influencing their risk, their oral health is influencing their risk for systemic disease. Some years ago, and this is no news to you, but for all of you who made the time to join us, years ago, an Italian scientist started looking at plaque in the hearts of people who had heart attacks. So in your blood vessel, you make a plaque and it blocks the blood flow. That's how you make a heart attack, right? And he started taking out pieces of this plaque and examining it, and found that there were bacteria in it. And then he looked at it, and what did he find? What the bacteria come from gum disease, right? And so when I tell patients to go see Dr. Nowak, they're like, but I have my own dentist. I said, then why are you here with bleeding gums and your dentist hasn't looked after it? That's a direct increased risk for heart disease. Now, we're here talking about the immune system, and you're thinking, oh, now she's losing her way and talking about heart disease. Did you know that you cannot make a heart attack if your immune system were functioning optimally? Right? Because it's that whole interplay between, so there's something called foam cells and how cholesterol gets integrated into the plaque. And the most important thing is that your immune system can stop that from happening or allow it to happen. So while you're being preoccupied with COVID, let me tell you, your chances of dying of a heart attack are much higher than dying from COVID.
And getting any other disease when your immune system is out of whack, right?
Right.
It's an
So-
overdrive.
Simple
It's
things like
ridiculous.
eczema and allergies, complex things like asthma,
Mhm.
and then there's inflammation or aging in general. All of these things are related to immune system dysfunction and
Mhm.
aging. So
That's
when you're
true.
working with a patient, like when, I have patients now, and I said bleeding
Mhm.
gums, right?
Mhm.
The old school information was brush it harder, floss it more. And when patients tell me that, my eyes go like this, because I'm like, oh my God, just send those bacteria faster and harder to where they should not go.
Yeah, and it's still the same thing today. And I think, as a wellness dentist, my goal is to get patients' mouth to the condition that it's not contributing to their overall health negatively, right?
Right.
So I kind of stepped out from a routine dental exam to personalized exams, right? And that's different. Say a patient comes with bleeding gums, and maybe they've been beaten up by their dentist or hygienist that meant well, right?
Yes, because that was the old way of teaching. It's
Right?
exactly like
Yeah.
how in medicine, there's new age medicine where I'm telling patients to do certain things, but the old way of old school
Exactly,
medicine
right?
says do it that way.
And they thought, oh, you're not brushing enough, you're not flossing enough, that somehow you've gotten this condition because of neglect on your part, right? So this is where I'm different. Oral healthcare is important, and kind of taking care of your teeth at home is important, but you cannot brush or floss away the inflammation, right? So I sit down with my patients and I said, you have bleeding gums, I'm concerned, maybe there's more I can do for you. Maybe I can teach you differently. Maybe I can implement different tools. Maybe we can measure those bad bugs that cause you to have inflammation. And we spend a lot of time listening to patients' stories, going over the lifestyle risk, the family history, right? Because that's going to set me on the right path, how I can manage that particular condition for this patient, right?
Right.
Same with the cavity, because if I just stop at fixing the symptoms, then I have not helped that patient long term.
Because we'll get another cavity
They
anyway.
may come next year with another cavity or more cavities, right?
So just talking about that, you said bad bugs and then you said inflammation.
Mhm.
So can you tell us what inflammation is?
Yeah, and we'll talk about gut and inflammation, right? And I think mouth and gut are the most abundant sources of chronic inflammation in the body.
That's
right?
why I send my patients to you, right?
And we know that. So healthy mouth is not free of bugs, right? And in fact, we have about 500 to 700 species of fungi, bacteria, and yeast in our mouth. Most of them are good, some are bad, but as long as they're in balance, we have health, and they're all beneficial. The problem starts when the balance is lost, right?
Exactly the same in the gut microbiome
Right.
as well.
And
And then it makes sense because they're all together, right? You start in the mouth,
Exactly.
then you end up
Well, it's
in the
one,
gut.
two, right?
Exactly.
It continues, right? So you have those high risk bacteria that starts to overgrow, and that sets your immune system, triggers your immune system, and then inflammation starts.
So that's what we
right?
call dysbiosis. So when we're
Mhm.
talking about dysbiosis, we're saying that lovely balance. Think of bacteria like a forest, right? You know how you have the different layers in a forest, the low brush, and then the slightly bigger shrubs, and then the trees that grow in the
Mhm.
shade, and then the big tall ones that grow in the sun, right? And so as long as everything works well, everybody's happy and the forest is healthy.
Mhm.
But then you have something upsetting that, and so the forest of bacteria, when it's upset, it's called dysbiosis. If you hear us talking about dysbiosis, then that's what we
Mhm.
mean.
And that's so damaging to the immune system, because it almost makes our immune system to get stuck in that on mode, right? Like it doesn't turn on, it's on high alert, and it's like your body is on fire. And why is it so detrimental? Because it makes the disease, if you get it, worse, right? Because your body doesn't have the mechanism to fight off the disease, and makes you more susceptible to disease. And another thing that's really critical is those bed bugs that are overgrowing in the mouth don't just stay in the mouth, right? They travel through your body and they settle in places we don't want them to, like walls of our arteries and other organs, brain and heart. It's very critical. And actually studies show that if you have high amount of those high risk bacteria overgrowing, it can double or triple the risk of heart attack and
Yes,
stroke.
I believe you.
Right? Yeah.
Because what it's doing also is it's adding to inflammation. So
Yes.
the symptom of the gum disease is inflammation. So it's red and it's bleeding and it's, you floss or you brush and
Bad
there's
breath.
bleeding, bad
Combination.
breath,
Cavities. Right.
And but inflammation is the process that underlies all of the diseases you do not want to get. And when I told you that you have a higher chance of dying of a heart attack than COVID, I mean, we have a lot of campaigns talking about breast cancer and prostate cancer, right? And let's prevent breast cancer and prostate cancer. Did you know that more women die of heart disease than breast cancer? That's a true statistic. So if that's the case, and something in your mouth could be adding to your risk for a heart attack, best you take it seriously. But here's something interesting too. What system in your body protects you from getting cancer? Your immune system. So if your immune system's not working well, you'll be higher risk for autoimmune diseases. Things like lupus, rheumatoid arthritis, psoriasis, vitiligo, the patchy skin. There's hundreds of autoimmune diseases, right? But when your immune system doesn't work, it's not protecting you in the way that it should. And so you start to make all these other things. And as I said, eczema, allergies, and other things as well. So imagine that you can have a symptom in your mouth alerting you to inflammation, like bleeding gums. So, Dr. Nowak, you do some very sophisticated testing.
Yes, we do, because why did I even start that? Because oftentimes gum disease at early stage is silent. We don't know we have it, right? We may have bleeding gums, but most people think bleeding gums are normal. Well, you have a bleeding elbow, that's not normal. You will tend to it, right?
I love that.
So same with bleeding gums, we should worry, right? But oftentimes it's painless, we don't pay attention. And because we haven't taught patients enough, I think, about how mouth disease can contribute to overall inflammatory burden in the body, right? So especially for people that are higher risk for cardiovascular disease, autoimmune diseases, we know that if we control that inflammation in the mouth, the systemic diseases get better and they're easier to manage as well, right? So now we have this tool, this technology that allows us to screen for bed bugs in your mouth. And it's a simple test, like you would do blood tests for your patients. The dentist can take a swab of the tissues around your mouth and your teeth. It's quick and painless.
Oh, it's just like that DNA testing you see on the crime scene things, like open your mouth, swab, and then
very similar to that, right? And what it does, it kind of allows us to map what's going on in the mouth. We can see all the bacteria, the viruses, the fungi out there in the balance, which ones
and measure the amount of dysbiosis.
Yes, so we can see which ones are overgrowing, which ones of high risk bacteria are overgrowing, right? So when we know that, then I can have I have ability to kind of shift them into health, right? I can have
exactly what we do in the gut. So when I'm working with patients, that's exactly it too.
Right?
We have testing that you can test the bacteria in the gut.
And exactly, because we try to bring that balance, right?
Yes.
So we can help the good bacteria grow better and decrease the amount of bad bacteria, right? And that's critical because then we can be more successful and more specific with the treatment because we know exactly what we're dealing with, right? And for patients, it means better outcome and better long-term stability of their health, right? So it's huge in my practice.
Okay, so we said inflammation is one thing, because we promised our audience 3 things that are affecting your immune system that you may not know about, right? And so one was inflammation. So in functional medicine, I measure inflammation and it drives my patients crazy because every few months I am measuring their inflammation and then I go, oh, look, it's going up, or it's going down, or oh no, it went up again. Why is that? And then of course I'm sending them to you because in my world, everything from leaky gut to food sensitivities to heavy metals and toxins and all sorts of things can affect inflammation in the body.
Exactly.
But once I've worked through those things, and as soon as I know they have blood on their dental floss or they have something like And I look in the mouth, not that I'm a dentist, but when I do a full physical on all my patients, and I look in their mouths, I look at their gums, I look at their teeth. And I send you patients just because I've seen something, I'm like, that's odd, or they have inflammation and I'll send them to you. So I just, I'm loving this conversation because now my patients know why I include you in their assessment, because they're like, but I came to see you, you're supposed to fix me. And it's like, no, we work together because there are things that you do that I don't do, in the same way that there's things I do that you don't do. So
Exactly.
it's a team, right? And then in your questionnaire, I see you ask a lot of medical history and background and all of that. And in the same thing in my questionnaire, I'm asking about mercury fillings, caps and crowns, bleeding gums, swelling, any kind of dental history. And my patients are like, why are you asking me all of this? So it's because there's no part of your body that exists in isolation. Everything is connected to everything else to make you you. But it's when things start to get a little off balance that you present with not feeling well. And whether this is fatigue or excess body fat or just not feeling well, or you could be showing up because you're on multiple medications and you're still not feeling good, or your doctor says, I don't know what's wrong, your tests are all normal and you're not feeling good. It's a clear sign that something needs to be discovered as to what the root cause is. And we don't treat just symptoms. So Dr. Nowak is not going to treat just the cavity. She's going to check out these bacteria, look for the dysbiosis, look for the inflammation, and then start working on all of that so that your overall general health
improves.
is improved.
That's true, because when we notice something is out of balance, or we notice issue, I want to know, like, how did it get that way? Why is it here, right? Because if I can get that why correct, then I have opportunity to help guide patients to a better health, to the level of the health they need, or it's possible for them, right? And again, this is really huge for my practice and huge for the patients, that we're just not, treating the symptoms, but we're focusing on the risks, because then people can have less dentistry done over the lifetime.
Yes.
Or dentistry they need can be less invasive. Their overall health is going to be
Well,
improved.
my son is in love with you, and he has never, ever been in love with a dentist. I couldn't even barely get him to a dentist.
He's a very smart young man, though. We have a nice conversation when he's in my chair.
But never mind my son, let's call this patient Roy for anonymity. But when I sent him to you, he was just surprised and resistant and everything. But he is a mid-40-year-old male. You know who I'm talking about.
Yes, I know.
And he is a total walking time bomb for a heart attack. He's got the family history. He's got the stress like you cannot believe, was a smoker until very recently, has the high cholesterol, has the high blood pressure. I mean, he checks all the boxes for someone who by the time they're 55 is going to have a heart attack, even though he plays hockey, builds muscle, and does all those things. That's the interesting thing. How many of you know of people who are healthy, athletic, and boom, in their early 50s drop dead of a heart attack? These stories are everywhere. Talk to people and they'll tell you this. Yes, I know someone, right? Yes. We all know someone who's healthy and they go, oh, their checkups were always normal. So they all have normal cholesterol, normal blood pressure, they're fit and active, and boom, they die of a heart attack. So what's going on there? And then on the flip side, you can have a lot of people who have high cholesterol. I've got a few people in their 70s and 80s that have started seeing me because they want longevity and quality of life as they age now, right? Yes. And they come in and they go, oh yeah, 15 years I've had high cholesterol and nothing's happened and I don't want any drugs, so I'm not treating it. And then you go, how come you didn't have a heart attack? Because high cholesterol is supposed to cause a heart attack, right? And so with this particular gentleman, he did have some cholesterol issues, but the bottom line is I sent him to Dr. Nowak and she found the dysbiosis of the same bacteria that Italian scientist found in the plaque of people who had heart attacks, right?
Yes.
And then he says, but I don't want to go see a new dentist because I love my old dentist. So I said, look, Dr. Nowak doesn't steal people's patients. She's like a specialist consultant. It's as if I sent you for if your GP sends you to a neurologist, you come back to the GP, right? You can maintain your relationships.
Yes.
And then he says, but she found this bacteria, but I've never had cavities, and I've never in my life have I had a cavity. I said, okay, but how do you know you're not making a heart attack process happen? How do you know this?
Exactly.
Right? And then I said, and then he said, yes, he has bleeding gums. So I said, okay, so then I'm sorry, but you've just been to your dentist in the last 6 months. He didn't understand that oral dysbiosis and periodontal disease can impact your heart disease risk, knowing what all is going on in your life and your medical history. So consider this a specialist referral. And he was like, okay, that makes sense to me,
Yes.
right?
I don't think we realize the impact of bleeding gums, what it tells us, right? It tells us that you already have inflammation, you already have infection. If it stays there long enough, it's going to create havoc in your system, right? We don't have symptoms of Alzheimer's or heart disease decades before it starts occurring in our bodies. And the mouth can tell us you're on the way, right? So if we recognize it and we treat it at early stage, like it's harder to recognize at early stage, it's easy to treat, right? I think maybe that's why some dentists that don't have that advanced training in this particular area are just managing the symptoms. And every time patient comes for a hygiene appointment, it's kind of the same appointment, right?
Exactly. And I think it's the same in conventional medicine, right? We're used to just doing tests, and only when they're abnormal or only when there's symptoms, then we think of doing it. Whereas, in functional medicine, we're predicting 10 years beforehand that you're going to be diabetic.
Exactly.
Why wait for the diabetes first when all the damage has started already to the blood vessels and everything, when you can predict it, and most important, reverse it.
Reverse it, right? Or because if you manage those risks early enough, or you recognize them early enough, you may not even manifest a disease later on.
Very funny thing that I say to patients, though. I say, when you're doing prevention, it's a thankless job, because 15 years later, nobody comes to you and says, thank you for making me not get the heart attack, right?
Because you don't know, right? What you don't know. That's exactly. Actually, there's been a study published in Journal of Periodontology recently that showed that people that have not gone to the dentist in previous years have 30 to 50% more mortality rate than those who went 2 or 3 times in a year.
Wow,
so that's huge. So now I'm saying to my patients, listen, those are the new studies, and I'm always backed by the research science, whatever I do in my management.
I noticed that you're very up to date in the research.
I'm always up to date, and there's new research coming up, and you have to be
Stay up to date. Same in our practice. Right? I mean, we have a director of medical education for that reason. Her job is to sit and read the research on a regular basis and update our protocols. And we do all the updates, and we attend all the continuing medical education from a longevity medicine and functional medicine perspective, so that we can stay cutting edge. And that's why I love working with you, because we're similar minded in that. But I have a burning question for you, because we're halfway through our session already.
Oh, are we?
Yes, we are. So in your opinion, what is the one thing that you think is most overlooked that impacts the immune system and inflammation in our patients?
I think stress would be.
And I'm with you on that. That is my number one thing. Absolutely. Yeah.
And you know what? I think we don't realize sometimes that we under stress. We kind of gotten used to it, right?
I agree with you.
We're on high.
I go for acupuncture sometimes, and Dr. Wu will be feeling my pulse, and he'll go, okay, you have a lot of stress today. And I'll go, really? I don't feel stressed. And I find it really, and then when he puts those needles in and I feel them and the difference, I go, could I be stressed? Oh I've got this and this and this and that and that and that, and I barely even got any sleep last week, and then, oh yeah, maybe I am, but we get used to it, and you adapt to functioning at a certain, like, I think it applies to everybody right now in this pandemic. I mean, now you ask someone, are you stressed? No, because we all got used to it.
It's been a year. It's the
Yeah.
new for us, and we
It's
don't
not
really-
new anymore. It's like
Right.
part of life now.
Yeah, and unfortunately, because it can create havoc, right, in your mouth health and again in your overall health as well, right? I mean, cortisol is detrimental.
So tell us how it
Everything.
shows up in the mouth. Like, I didn't even realize that
Yeah.
stress, other than like
Stress.
grinding your teeth and wearing them away.
Yeah. And that can happen over time too, but more obvious signs would be bleeding gums.
Stress
Yes,
and bleeding gums.
Yeah. You can build up more plaque, your gums will bleed more. It's cortisol that destroys the blood vessels. And sometimes when you're under stress, your oral home care is not ideal.
That's right, because we go to our worst, I tell patients this all the time. You go back to your worst habits when you're stressed.
You stop caring.
You just don't care. That's right. Well, I didn't realize that part, but I mean, like, I'm so intrigued to hear how stress affects the mouth.
Yes, it does, because it triggers your immune system. It causes inflammation, right? And it causes inflammation in the mouth as well, right?
Well, that just makes sense. Why didn't I think of that? And I nag patients all the time. Cortisol is a tear down hormone. Cortisol helps you create more fat. Cortisol damages your immune system. If it's too high or too low, it's affecting how your immune system works.
It disturbs your other hormones, right?
Absolutely.
Yeah.
Yeah.
And on the TPI, it causes
Makes you gain weight by disrupting the whole metabolic triad.
leptin and ghrelin, right? Yeah, and for teeth, it causes sensitivity, where, as you mentioned, you may have
sensitivity.
Yes.
Teeth
teeth can be
sensitivity.
more sensitive because of the clenching and grinding that creates little crevices in your teeth, little cracks, and tooth responds by being more sensitive.
No way.
Yeah, it can even cause bone loss around your teeth if you grind
Now
your
that I'm
crunch
terrified
stress.
of.
Yeah.
The bone loss.
Yeah, it's like disruption of bone metabolism, really. That's what periodontal disease is. So we have gum inflammation long
So
enough.
all my osteopenic patients and osteoporotic patients should be coming to you
Yes.
as well.
Yes.
Because I just saw a lady today. She's a brand new patient, first visit. And I said, so what made you choose my practice? Because I mean, obviously you could just go to your family doctor, or, why would you choose a private clinic for functional medicine? And she said, well, I have osteopenia and I don't want it to get worse. In fact, I want to reverse it. And I heard that hormone therapy can reverse it.
Right?
So I said, thank you for that. That's very well known in even regular medical circles, that taking some hormones can help osteoporosis and osteopenia. But did you know that that's not the only thing? And never mind all the vitamins and minerals and nutrients that you need, but we have to assess what's tearing down your body.
Exactly.
And do you have enough to build up? Because, it's that whole catabolic, anabolic balance, right? Cortisol is tear down, and then you need to balance it with the build up stage as well, right?
Yes.
And so the bone loss in the mouth would be the same
if I notice bone loss in the mouth, I'll send patients to you, like, find out if there's anything systemically going on that manifests in the mouth, because any systemic disease may manifest in the mouth, and the mouth.
And I just said to her, I said, in the last year, we've reversed 3 patients, taken them from osteoporosis to normal bone density, which they had no idea was even possible. They were told, well, you've got it, now just stop it from getting worse, whereas we're building them up again.
Yes. And in dentistry, now that we have this oral microbiome testing, right? Then we have specific protocol. You need training, to be able to manage that and interpret those tests. But we have very good results to stabilize patient over time. It may take about 4 months.
And then I can help you reverse it.
Yes, right? So it's always have to be from within, right?
Yes.
From inside out and outside in.
That's right. Okay, so we said 3 things. We covered inflammation, which affects the immune system. We covered the microbiome, oral and gastrointestinal, which affects the immune system. And now we've talked about stress, which affects the immune system. So is there some sort of guideline, like maybe we said 3 things impacting your immune system. So would you have 3 things that you think patients should do at home? So nothing complicated, you know, especially
Nothing
somebody who's
complicated.
stressed out and just really can barely get their shit together, pardon my French.
Well, it's challenging
So,
when
so
it's
what
stressed out,
can
right?
you give
So-
someone as
so-
a simple home advice?
From a dentist.
From a dentist.
From a dentist.
No, from a wellness and
From a
holistic
wellness
dentist.
I say, practice your sleep hygiene. That's really important.
Okay,
If you can talk about that, maybe more.
Why?
Because
why should they focus on sleep?
because it will lower your cortisol, it will lower your stress, your
Mhm.
body will regenerate,
Mhm.
right? Your brain will regenerate during your sleep, right? So we can handle a stress better.
I
when
see
you
some
wake
of
up.
my patients online here. So see, when I tell you to focus on sleep and you don't listen, here's someone else telling you to
Yeah.
focus on sleep.
It's easy to sleep, right? Unless you're a new mom, right? Which
Or your
can be
hormones are
challenging.
all
Or your
whack,
hormones,
and
or
then-
you're going
but-
through menopause, and
yeah.
that hot flashes, but.
But I can fix all of those.
Right. Yeah, like even changing the diet slightly. Make sure you have green tea and turmeric in your diet, right? Enough omega-3s.
Early in the day,
Right?
though, yeah.
Yes, so because those are anti-inflammatory.
Okay, so
Tools.
sleep and then anti-inflammatories
Yeah,
in
so
your diet.
yes,
Okay.
very, very important. At home, tools you can use coming from a dentist, that would be water pick. I highly recommend water pick,
I
which is
don't
like
have one of those.
water floss. It's even more effective than floss because it goes deeper to clean.
No
your teeth.
way. I
Yes.
love flossing my teeth. I have to
So
tell
you
you.
floss
I
first
love
and then you
flossing.
water pick next. So you're just taking your home care to another level,
Okay, cool.
right? And you can even add for extra empowerment to your water pick, grapefruit seed extract. About 20-30 drops of that into container of water pick, very potent antioxidant.
Neat.
Yes, patients have great results in my practice of properly using water pick on top of.
And so that would
brushing.
decrease the inflammation of the gums, get rid of
Yes.
the bleeding.
Yes,
and
and
all of
flush
that
all the
stuff.
bacteria or little
Flush.
plaque that you're not removing by brushing or flossing alone, right?
Okay.
Chewing
I
xylitol.
learned something.
Yes.
I'm just learning a whole ton of
Good,
stuff
I'm
from
glad.
you.
Yeah, chewing xylitol gum, very effective for anti-cavity properties and
So-
even promoting saliva in your mouth. Some people, because of the stress, your mouth can get dry. You may be more susceptible to canker sores, and with drier mouth comes increased risk for cavities. So xylitol gum, simple.
And I tell my
Simple
kid
tool.
not to chew gum at all, but I
No,
should
you
get
can
him
chew,
to.
but not for too long, 10-15 minutes, few times a day. It produces a good
Xylitol.
saliva.
I love xylitol
Yeah.
because, we tell patients to be sugar-free because sugar is so inflaming, right?
yeah.
Like one of the most inflammatory substances, bar none, is sugar. And I mean in all its forms. So please don't ever think that sugar is just that white stuff you put in your tea or coffee. Sugar is in everything, and almost everything you consume converts into sugar. So carbohydrates, processed foods, your bread, your muffins,
Pastas.
your pasta, your oatmeal, your
Granolas.
potatoes, your granola, all of that. And then our red wine, right? Like alcohol is a sugar.
Yeah.
So should I just chew gum after that? Xylitol
Yes.
gum and then, so glass of wine,
Yeah,
xylitol
I would
gum,
tell you
glass
to
of
drink it
wine.
through the straw, but that takes away the effect of the wine. So, yes, so xylitol gum.
I am not
afterwards.
drinking wine through a straw.
No,
No.
I wouldn't.
I started
recommend that.
drinking my metabolic optimizer shake through a straw because
Yeah,
you said
with
so.
turmeric, right?
Yes, because it
Yeah.
stains my teeth and
Yeah.
I'm tired of yellow teeth
Yeah, and
now.
healthy mouth is about keeping the pH level of the mouth higher up. If you can have alkaline mouth, less chance for the bad bugs to grow in your mouth too.
Mhm. Sorry, I'm gonna do a time check. I
How
didn't
we
think to
doing?
have a clock in front. No, we're good.
We're doing good.
I just, had to be obvious and look at the time because I have to respect all of your time. Especially at a time like this, it's close to dinner time, you've got family and all of that. So, that was amazing. Like that was amazing stuff to learn.
Yes.
So I can go back to drinking wine because I kind of stopped drinking wine for a while.
Yeah, and
thinking I
then
just
you
need a
eat
break.
a lot of green leafy vegetables, balance it out.
for the acidity and the alkalinity.
Yes.
So you're saying eat a kale salad with my glass of wine, but it's not as good as a steak, Dr. Nowak. Come on.
Or combine it, like you have to balance it out so you don't.
So I'll
you
just
have
chew
good
the gum
balance.
after.
Yes, chew it out.
Gum.
Yes. Or have a glass of water, just neutralize it, right? I tell my patients, some of my patients like to drink lemon water.
Yes,
Right, in the
it's a big
morning.
thing because people think it's very healthy and
Mhm.
it is. It helps with the acid-base balance of the body.
Exactly,
And in functional
exactly.
medicine, we talk a lot about alkalinity and staying in, keeping your body in an alkaline environment, right?
Mhm.
And cortisol, when it's high and you're stressed out, cortisol does increase acidity.
Mhm.
Changes the pH.
Yeah,
and
our
all of
body's
that.
smart. It keeps the pH at the healthy
Mhm.
range, but there are
So
those.
drinking half a lemon
Yes.
in water twice a day has been shown to help improve alkalinity.
And
except-
digestion, right?
Except that it changes the acidity in the mouth.
Yes,
and
so
damages
I
the
encourage
teeth.
my patients to use a straw, so then it doesn't cause that acid attack on the teeth, and then you can have erosion, like loss of minerals from your teeth. You don't want that.
Okay, that's perfect.
Right?
So, for me, my approach to the immune system is very simple for patients. I break it up into three things.
Mhm.
And this is not an at-home, actually, I can give you the at-home things you can do for each thing. So I say to patients, there are three things that affect your immune system. The first one is cortisol, right? And too high or too low is going to not let you manage your immune system efficiently and effectively.
Mhm.
So people will notice when they're stressed out, they get more hives or more itchy skin, or they react to things, or they get their eczema. Now, let's just think about medicine in general. When you get an inflammatory-based disease, so eczema is treated with a cortisone cream.
Mhm.
Cortisone is a metabolite of cortisol, and cortisol is your stress hormone. So if you take a few steps back, what are you saying? You ran out of cortisol, your body made asthma or allergies or eczema or autoimmune disease, and all of them are treated with prednisone or some derivative of prednisone, which is cortisol. So what we're saying is your cortisol is too low, your immune system's not working, it's showing up with these diseases, and now we're going to treat you with a metabolite of cortisol. So how about before all of this, we start managing cortisol? So what can you do at home to manage cortisol? Well, you can't get rid of COVID, because if you could, you'd be a billionaire right now and on owning your own island somewhere. You can't kill the spouse or the boss or the whatever that's stressing you out. So what can you do at home to manage cortisol? Meditation by far has been proven to help you change your body's stress response for the better.
Mhm. And this is so true. I started meditating. I'm trying to develop that into daily practice. And I notice it just sets the stage for my day. I just handle the day differently, whatever comes. I'm more calm and I'm more detached.
Centered and detached from the issues of life.
Exactly.
Now, I unfortunately have been practicing meditation for a few years now, and I still can't really do it well. I have a really busy brain. So it's called a practice of meditation for people like me who have to keep practicing every day.
I think everyone
But
does.
you have to just keep at it. Now, I've got patients who say, I hate it, I will never do it. So the alternative is mindfulness. And there are studies that prove it works, right? And so you can see that the cortisol rising and falling is not as extreme. Another thing that I found makes a huge difference is medical marijuana. And I in no shape or form I'm saying you need to be high. I have never been high on medical marijuana, but it has been shown to modify the stress response. And so people get less stressed out. And with medical prescriptions, we don't use it, you can use it recreationally. There's nothing wrong with that. But I do find that for many patients, the CBD component helps the anxiety And a little bit of THC in a non-intoxicating dose really can help people get a handle on the stress
And
when it's really
it
high.
can help you sleep as well.
It helps
CBD
sleep,
oil,
but
sleep.
here's the other thing. We've seen studies that cannabis helps cancer, right?
Yeah, I
And
think-
cannabis helps the immune system function.
Mhm.
So I've been prescribing for years now, and I have to say I've seen the benefits in so many people that I say meditation, mindfulness, and cannabis all go in the same line.
Well, it has less side effects than some other modalities, some antidepressants. right?
Exactly. And I'm not saying we're using it instead of,
Mhm.
but I'm saying that when you're highly stressed, and then the nice thing is the prescriptions are covered by healthcare. You know, a medical prescription is 30 to 40% less than buying it recreationally.
Mhm.
So
It's,
medical
it's
cannabis
controlled
can
now,
be,
so there's more and more
Yes,
studies
and
supporting its medical use in
it's
certain
medical uses.
situations. Yeah.
I mean, now if you can go across the street and buy somewhere in Kensington, for goodness sake, you can
Mhm.
buy some right here. But like I said, you know, for me, it's more of a medical thing where we're dosing very precisely for immune system health, for stress management, and all of the other benefits. And by the way, medical cannabis has been shown to help digestive health,
Interesting.
right? So it targets multiple things.
Well, I guess
So-
when you're more relaxed, you digesting better as well.
I think so
right?
too, absolutely. But I think the anti-inflammatory benefits as well.
Yeah,
You know, I mean, I guess we could just find all kinds of, all I care about is it works.
it works.
So cortisol, too high or too low.
Mhm.
The next area I say to patients we need to target, and this is where you come in for my
Mhm.
practice, is toxins, right?
Mhm.
And so I have patients look at all of the sources of toxic burden in their body. And this is way beyond what I have just a few minutes left to talk for. So toxins suppress immune system function. And you can get toxins from petroleum products and derivatives, the plastics, the phthalates, the bisphenols, and all of those
Environmental are
things.
everywhere.
And so I divide it into quick categories. You know, look at your home care, everything that you clean your house with. Look at your body care, from what you put on your hair down to your toenails. All of those things have toxic molecules in them. Food, herbicides, pesticides, chemicals, preservatives, colorings, whatever.
Everything, Natasha.
Everything, right? And so you got to start looking at where are the toxins and how do I reduce my exposure to toxins. And then from a functional medicine perspective, we help you improve the elimination of these toxins that build up over a lifetime because they are immune suppressing. But the next arm of toxins is heavy metals, right? And
Very
so there's
common.
lead and mercury as the two big ones. I'm seeing a lot of arsenic and cadmium, but I have, you know, different things to talk about there. But mercury from eating a lot of fish, and a lot of patients love sushi. We used to eat sushi at least once, if not twice a
I
week,
love sushi.
until I started seeing in patients that like I actually discovered this by accident, and there's a patient who has a home in Vancouver, and she said, no, there's no way, I have no fillings, my mom wasn't a smoker, I've never smoked, I don't know where I could get mercury from, test me again. And we tested her and she was negative. And then we tested her again and she was positive again. And it turns out that every time she's in Vancouver, she's eating sushi twice a day, every day. And there's tests that you can do to decipher whether it's acute or old.
Yes,
and
or whether
stored,
it's coming
right?
from
Yes.
environmental or your mercury fillings
That's
in the
right.
mouth, right?
So one of the things though, people say, but I had all my fillings removed. So then I have to educate them and say, you know, it does store in your body, and especially around menopause and andropause. So men lose bone as well. So osteoporosis and osteopenia are not diseases of women only, right? And
And are women more susceptible though?
you'd be surprised.
Really?
Because now
Interesting.
I'm doing bone mineral densities on men older than 60, and I'm finding a lot of them have osteopenia. maybe not full-blown osteoporosis, but osteopenia.
Mhm.
And so now I've just said to them, as your hormones change, because my specialty is hormone balancing,
Yes.
right?
Well,
But-
for men, hormones change as well.
Exactly.
Right.
So then I gotta have that conversation with them and say, you're not here just for longevity. Part of longevity medicine is balancing hormones, because hormones keep you young and vibrant, right?
Mhm.
But it's amazing how many men have low bone mass, right? So as you're losing bone, you're releasing stored heavy metals, and that's when you're seeing it come out and cause issues, which increases inflammation as well. But so when I have patients who still have 1 or 2 fillings, the reason I send them to a holistic dentist is by removing a mercury filling, and I had to leave a dentist who laughed at me and said I was absolutely out to lunch with my beliefs in mercury affecting the body, because of course it's safe and of course it has no health impact. And I thought, I will never set foot in your office again.
Mhm.
But that being said, when your mercury fillings are removed just like any other filling, what happens, Dr. Goska?
Well, it gets absorbed into your system.
It gets back into your system. So when patients tell me it was removed, I have to start looking for it even deeper and find it and get rid of it. And when they have not had their fillings removed, I send them to Dr. Goska, because she understands that she needs to stop it. The fumes have
Yeah, we have to use special suctions, and sometimes we prepare the patients like you would do IV injections with the vitamin C just to prompt the immune system,
and all
right?
of that, right?
So that helps make your body more resilient to absorb those fumes.
And then you take special precautions to remove the.
Yes, we have
metal
special
fillings.
isolations on patients.
Yes.
And we have HEPA filters in our facility too, to clear the air, so we're not exposed and patients not being
Right.
exposed as well. Yeah.
So cortisol, and then all the things you can do at home. Toxins, so you're going to lower your toxic exposure. Try to eat organic if you can. Try to use more natural products.
No
And then
processed,
become
right?
more aware of what is the dirty dozen for foods, like fresh produce. And then there's a dirty dozen for skincare. Like there are certain molecules that are more toxic to the body, and those ones would be more toxic to your immune system. And we know that almost half of our patients are poor methylators, and they're not going to detoxify efficiently anyway. So we have to be mindful.
You're getting very technical.
I'm
Natasha.
getting very technical, yes. So for you and a non-technical way, about half of the people in our population do not have the ability to process our toxins efficiently. And over time, they will collect them in their body. So from all of you there, half of you, and you'll slowly collect them. And by increasing this amount in your body, it will suppress your immune system function. So in a functional medicine program, we help you get rid of these toxins, right? And then the third thing is nutrients. You need the right amount of nutrients in your body to be healthy. So whether it's to build muscle, make healthy brain chemistry, or to support an immune system and regenerate it, you need good nutrients. And
what are the basic nutrients or the most important, if you were to name 3? What comes to your mind? Let's keep it at 3.
3, B, always methylated Bs, magnesium. And then the third one, I'm torn because now you're having me pick. I don't know.
Okay,
if
let's do 5.
No. Let's just keep it to 3.
Okay.
But this is where customized, personalized medicine is important, right?
Yeah, it's not for everybody. Everyone is unique, right?
Yes, but I would just say take a good spectrum multivitamin.
Really?
Because it's got, so some minerals and vitamins are antioxidants as well. So I was trying to pick in my head, if you gave me just 3, then would I go with antioxidants or would I go with multi-minerals? And then people want a healthy immune system, so then there should be some zinc and there should be some vitamin A, and we're not optimizing the doses, but some's going to be better than none. And then if you want to get more technical, the micronutrient deficiencies that occur especially are exacerbated or worsened when you're under stress. When you're under higher stress, your body's working harder to try to cope, and you're using up the nutrients that you're taking in and that you have available. When you have a lot of toxins in your body and your body's trying to process them out, you're using up your nutrient stores.
Yes.
And so your overall nutritional status is dependent not only on what you eat and what you have and what vitamins you take, but what other stress and demands there are on your body.
Because your body doesn't repair properly, right? Because you're using all that energy for different reasons. And your brain cannot be working optimally either, right?
Nothing works when you're stressed.
Yes.
Nothing works when you're depleted.
So really stress and inflammation are the culprits of breaking your body down over time. And the older we get, the more inflamed we become.
So then you can say hormone imbalances is the third thing, stress, inflammation,
and it all ties together.
Everything's connected to everything else. So,
and it starts in the mouth.
And it starts in the mouth. And with that note, or on that topic, you have, people have the ability to access oral microbiome testing through you.
Yes, actually, and just to thank everybody for attending this webinar, I would like to extend offer of free oral microbial testing with new patient exam in my clinic. It's Anita's Dental.
Oh my gosh.
Yes.
Did you say free?
Yeah, it's about $350 value.
I know.
Yeah, it's very sophisticated
I
test.
know. Okay. Can I come as a new patient?
Yes.
Are you sure?
Yes.
I've been to your
I'll see you again.
I'll be a new patient. I'll be a new old patient.
Yes, we haven't done that for you yet.
I want it done so badly.
Yeah. Well, you don't really have to have obvious signs, obvious disease, or even be high risk. You just can do the screening and see where am I, right?
My parents both have cholesterol problems, diabetes. My grandma died from her diabetes.
You're high risk from the family history.
And both my parents have no teeth. So
that's going to be huge for you too, I think, do that test.
I mean, I have teeth, thank goodness.
And you want to keep it that way,
And I want to keep it that way. Thank you. Yes.
So and you want to stay younger because right now
I'm only 25, Goska, as I
know. You want to stay 25, right? I know that. I think now going to a dentist and having your teeth clean, like from all the studies that come out, it's not
it's not enough
now.
Yeah, but it's not enough if you have this testing available. So wow, it's for free.
Yes.
If you come in as a new patient, I'll get all my referrals in this week.
I'll be happy to see your patients, but it does provide really important benefits.
I think so too. So then now you're putting me on the spot. What do I have for patients?
What do you have for
I don't have anything for patients except me. No, actually we have, so I will send, if you're interested, I'll send you a questionnaire that helps you evaluate your current state of aging and hormonal imbalances. And then we have a wonderful resource for our clinic patients that I'm happy to share with you on this whole topic of toxins and where they come from and how to get rid of them.
I would love to do that anti-aging evaluation. So I don't think they've done it. I think that would be great.
I think so.
I think it's great for every woman or man, right? It's good that we have that available because it just gives us more insight to what's going on in our body before we get sick.
And that's what it's at. You know, I'll tell you, if you look at my family history, I think I do pretty darn well when, you know, most of my family, you know, early 30s and 40s on medication for blood pressure and diabetes and cholesterol and all sorts of things. And I have to say, I'm going to be 50 next year and I am medication free.
Yeah, but you work hard on it, like you know what to look for, right? And
it's not easy. I mean, I'm not going to sit here and tell you that it's easy because you do the same thing. And I think that's how we align so well. Like you're committed to healthy aging, as am I. So yes, we're going out for a glass of wine after, but I guarantee you there'll be xylitol gum after and some kale salad or something.
Well, it's a journey, it's a process, but you know what the good thing is? It takes long time to get sick, but it can take months maybe to get better if you're on the right protocol, right? So it doesn't take as long And I think that's important.
That's a great take-home message, I think, for everyone, right? In that we have the tools and the capacity to
We have resources.
undo the damage that's been done and buy extra time to enjoy life. Because I just said to a lady today, I said, you know, your shoulder, because I was doing her physical, and her shoulders were kind of hunched forward, which is what happens with everybody on their computer. In fact, just do that. Like, just see if your shoulders are actually straight, or if the ball and socket joint is pulled forward a little bit, right? And the best way to test is put your arm out on a door frame and feel how tight it is to open up that way. And so I said to her, I said, you know, you're 64 and you're shortened. Well, you're gonna live to at least 90. The average lifespan is between 80 and 90. I said, the question is, do you want to be able to wash your own hair and put your groceries away? And then by the same token, do you want to get off the toilet by yourself, or at 90, are you going to be in care and somebody else doing all of this for you? And she goes, well, what do you think is the answer? And I said, well, then we have to start looking at now, not just your hormones, not just your diet, not just your stress and all of those things, but you have to look after your physical body as well. So chiropractic, acupuncture, all the things that we have right at our clinic in the team to help patients.
And it's really nice because you have everything under one roof, right?
Right.
Which is very good for patients, and then you can collaborate with your other specialties, and everyone says, look, oh, they really know me, they know about me, right?
We know everything about them, yes. But that being said, what you said was really good, because once we identify it, we can say to you, you've got another 30, 40, 50 years ahead of you. How do you want to live those years? You know, do you want it to be as vibrant? Who's going to say no to this? You know, everybody wants a good, healthy life. No one wants it to be in a nursing home and in long-term care.
I think everyone wants longevity, but people want vitality as well.
That's right. But you can't get that by sitting on your bum doing nothing. Because if you keep doing the same thing and none of these new things, then you're not going to get the results you're looking for. So those simple things like coming on in and getting an oral health assessment and your swab, you know, take the test. It's just a simple form to fill in to see if you have some hormonal imbalances, learn about toxins. You know, you can come on in and get, actually your value is, you said you're giving them $350.
Yes.
Okay, I have to match her now. So our initial assessment, so we have a full longevity assessment in our clinic. So if anyone's interested in coming in for the assessment, then we'll give you $350 towards that assessment.
Excellent. Thank you, Natasha.
Yeah, I think we'll just do the same thing.
Yes,
So
that sounds really good. Yes. And hopefully people will take advantage of that, because we know, like, we've been talking about COVID and it's still an issue,
It's
right?
time.
But
it's time to start. You have the time. You're still not back at the office. You're still not back in the rat race. So now's the time to find out what's going on and then take the steps to do it.
Because you'll be more resilient. I mean, inflammation causes you to be less resilient to getting flus or colds, right? And COVID is one example too. I mean, COVID has been not friendly with our inflammatory patients, right?
Not at all. And when you're inflamed, you get it worse.
Yes. So cleaning your teeth, getting your exams, I think it's critical.
Yeah, so
during
the top to bottom test between the two of us, you'll get it all done. I think that's amazing.
Yeah,
I think that's a great package. So come see us both.
We'll love to look after you.
Yes. Thank you for your time. We so appreciate your attention. It really takes someone interested in their health and well-being to give an hour of their time, because it's so much easier to just be out on a patio now that they're open.
Yeah, and I think even like I just have to congratulate everyone for attending, because that says a lot about how they care about themselves.
We appreciate you so much. We appreciate your time. Thank you.
Thank you very much.